Yellow stool may be something strange that you see, and you could be wondering, what the heck is going on? So in this video today, we'll discuss exactly what does yellow stool mean, what are the causes of yellow stool, and at the very end of the video, I'll give you my recommendations if you should be concerned if you have yellow poo. Guys, let's literally talk about poo. Howdy y'all, Dr. Islam here, aka your poop guru and gut microbiome expert. I'm a board certified gastroenterologist trained at the Mayo Clinic. Come see us at Love Gastro for all your GI needs. So number one, is yellow stool considered normal? Well, the answer to that question is yes, it is. Your stool has a wide spectrum of normal. So let's go over that really quickly. Number one, brown. Any shades of brown are completely normal. It doesn't matter if it's dark brown, light brown, or medium brown. Brown is your friend. That is a normal stool. And within that normal spectrum is also a yellow stool, and that's perfectly fine to have this. Now, there are three main reasons why people can have a yellow stool. Number one are dietary factors. Your diet plays a significant role in the color of your stool. So certain foods have certain pigments that make it more likely for your stool to turn yellow. These are foods like carrots or even sweet potatoes, which you have in a lot of abundance, can turn that stool yellow, and it's perfectly normal. The specific pigment is called beta carotene, and as it passes through the digestive system, it can turn your stool yellow. Not a big deal whatsoever. Number two is getting your gallbladder removed can make it more likely for your stool to turn yellow. Your gallbladder is an organ that stores bile. Bile helps to break down fats into its smallest component. And if you don't have your gallbladder, guess what's going to happen? You don't have the storage capacity to hold on to bile, which means bile is going to reflux into your stomach and into your small intestine. There'll be a ton of bile just pouring out, almost like a waterfall, just going down your GI tract. And so because of that, bile cannot properly digest or break down fat. Or it could be too much bile into your GI tract, causing your stool to turn yellow. It is very common for my patients who've had their gallbladder removed to have yellow stool because of the fact they don't have their gallbladder anymore. That is literally a consequence of getting that gallbladder out. And it's also maybe a reason why you may see oily stools as well. I know, but that is the inability to absorb fat, which can cause that layer of oil in your bowel movement. Once again, completely normal. There are some medical conditions that make it more likely for you not to absorb fat, things like chronic pancreatitis, celiac disease, or a condition called small intestinal bacterial overgrowth. So having yellow stool could be a sign of one of these conditions. If that's the case and you don't know it, we can do further investigation to find out exactly what is going on, and also to make sure if or if not you have these conditions. So this video is probably sponsored by Love Gastro. Yes, that is my clinic. If you're suffering from GI issues, if you have anything going on inside your gut, our clinic is the clinic to take care of you. We try to do a more natural approach to help out with your GI issues and all your gut issues as well. So if you're looking for gastro help or even liver help, come see us at Love Gastro, where we can take care of all your GI and liver needs. So here's when you need to kind of worry if you have yellow stool. So number one, if your yellow stool wakes you up in the middle of the night. Having nocturnal stooling, meaning it wakes you up in the middle of the night, is never normal. It doesn't even matter what the color it is, but if you have that in combination to yellow stools, there could be a sign of an inflammatory condition going on inside your gut. You need to get further investigation to find out exactly what is going on and see if there's something else that we need to investigate to get that taken care of. Number two, you have extreme weight loss with the yellow stooling. Once again, weight loss is what we call a warning sign, a red flag that we wonder if there's something else going on besides typical GI conditions. So if that's the case, see a GI doctor like me to see exactly what the true cause is. Number three, severe abdominal pain. Once again, abdominal pain, especially associated with bowel movements, can be normal in some individuals, but if it's severe, persistent, and we can't find out why, that is another reason to see a GI doctor for your yellow stools. Guys, as always, remember this video and other videos like this are just for medical education. This is not your particular case. So if you're worried about your yellow stools, see a GI doctor, come see me so we can find out exactly what is going on, so we can do an investigation to see, is this normal or not? But in most cases, yellow stool is on that normal spectrum of nothing bad going on. So if you're concerned about your stool color or any other GI issues, come see me or someone like me so we can find out exactly what is going on, address your concerns, and see if there's something else we need to do to find the reason for your GI issues. Alright guys, thank you for watching. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my channel and newsletter, where we can get great tips and tricks like you're learning in today's video. Thank you for watching. Don't forget, let's talk about poop. Thanks everyone.